So should we start?
Ma'am, Richa is here. Richa, can you please switch on your camera once?
Maybe it will go live on YouTube.
No, I think we should edit and put it on YouTube. It's always better.
Yeah, it's a 1 hour thing. We can, but jaldi kar lena usko. Edit में भी कुछ ज़्यादा नहीं होगा. Let's not take too much time. Or we can go live. It's a non-formal discussion. We are not making policy points here.
देख लो आप लोगों को जो suitable लगे.
What do you think, Ankita?
No, I agree with Ruby ji. Let's edit and put it. I mean, why be in such rush?
How do we generally do it?
So we edit and put it.
So ours
We live stream it.
Stream it, then do live streaming.
But I don't know if
you have to put your handles then, na?
Yeah. It's okay, ma'am. Otherwise, we'll just
start. No, we'll edit it and
take the recording on Drive and then edit it.
Yeah, it's okay. So, Shabana ji?
Is the recording on already?
Yeah. Ankita, can you start it then? Yeah, who's starting?
Richa, please go
Richa
ahead.
is supposed to.
Yeah. So good afternoon to everyone present here. I, on behalf of BRICS Chamber of Commerce and Industry, take utmost pleasure to welcome you all to the webinar on health sector, challenges and opportunities for women entrepreneurs. The BRICS Chamber of Commerce and Industry is a parent organization that promotes commerce and industry in the BRICS nations. The chamber was founded back in 2012, is a registered body under Societies Registration Act 1860, impaneled with Niti Aayog and recognized by the United Nations. BRICS CCI Women's Wing is launched by the BRICS Chamber of Commerce and Industry. The focus is on women empowerment initiatives and policies across geographies. The objective of Women's Wing is to create an enabling support system for women entrepreneurs and professionals across geographies. The Women Wings also organizes trade fairs, exhibitions, seminars, symposium, mentorship and training programs, lectures and business campaigns from time to time to intensify the institutional links and business relations between BRICS countries and other friendly nations. So here we are. The health sector in India has consistently been flourishing and is one of the fastest growing sectors. With the amalgamation of automation and healthcare in India, the sector is graced to establish new landmarks. The sense of technology has facilitated the other sectors of the country like teaching, finance, which is adequate proof for its potential to easily impact this sector effectively. An emerging trend in healthcare management is the phenomena of medical tourism or the mixing of tourism with visits for medical treatment. In the 12th BRICS Leaders Summit, the Honorable Prime Minister of India, in his remarks, stated that India would focus on consolidation of intra-BRICS cooperation, including in the fields of traditional medicines and digital health, people-to-people ties and cultural exchanges, and would work towards boosting BRICS collaboration in these fields. So I would now request Dr. BBL Madhukar sir, who is the Director General at BRICS CCI, for a welcome address. Over to you, sir.
Sir will be joining a little later. You can call in Shabana ma'am.
Okay, so now I would like request Shabana ma'am to take it forward for her special remarks.
I welcome the panelists and the entire chamber to this webinar. We, on behalf of BRICS Chamber of Commerce and Industry, would like to welcome all our panelists, our workers, our other team members to this webinar. Thank you for a very nice introduction, Richa. And our Director General, Mr. BBL Madhukar, is not available today, so we will be taking it forward ourselves. The Chamber of Commerce and Industry, as Richa has already informed you, is basically, started in 2012 by certain eminent entrepreneurs and professionals with the intention of promoting trade and commerce between the BRICS nation. The BRICS Chamber of Commerce has various verticals, out of which women vertical is a leading vertical. The women vertical was formed to give an enabling environment to all the women entrepreneurs, the aspiring entrepreneurs, the existing ones, and a networking platform for all such women entrepreneurs who would like to trade between the BRICS nation and more and beyond. Today, we have gathered to have this webinar on the healthcare sector. See, the healthcare sector post-COVID is a very, I would say it's a sector which is extremely critical, because we have seen that India has suffered, not only India, globally, all of the entire globe went through, we went through a lot of turbulence. There was a global turbulence. Nobody was prepared for this pandemic. But India has actually geared up. We have pulled our socks as a nation. We have done a lot within these last 2 years. We have recovered in a large way. We are one of those nations who's got vaccinated. Almost we can claim that 90% of our population has got vaccinated. There is a sense of wellness within our countrymen. We feel very protected. Even, today, while so many developed nations are still struggling within this COVID time, we as a nation feel much more protected. And thanks to our government, thanks to our workers, our medical institutions, today we have some very eminent panelists within us. Dr. Padma Pandita Muku from Jai Shri Ram Hospital, Dr. Priyanka Göyat, Dr. Sushmita Yolisa, she is our international panelist. Dr. Swati Maheshwari, she's also here. I would like to introduce the other people available in our webinar. Arubi Sinha is our convener. Sharmishta Ghosh is our director for BRICS CCI. Ankita Sachdeva is our additional director. Suzanne is also additional director with BRICS CCI. So here is our team. And over to you, Rupiji, for the webinar.
Yeah, thank you, Shabana ji. I think one of our panelists hasn't yet joined, Dr. Sunshine, but we'll start nevertheless. Hello, everyone. The pandemic has brought health and wellness into the forefront across the globe. Health is undoubtedly the most important asset we have. As such, the healthcare sector has emerged as one of the biggest opportunities for entrepreneurs globally. Quite a number of innovative startups utilizing the latest technologies to improve healthcare quality, accessibility, and affordability have come up. In fact, at the 12th BRICS Leaders Summit held in Russia, the Honorable Prime Minister in his remarks had stated that India would also focus on consolidation of intra-BRICS cooperation in the fields of traditional medicine and digital health, and would work towards boosting BRICS collaboration in these fields. With this context, I would like to extend a hearty welcome on behalf of the BRICS CCI Women's Wing to our esteemed panelists and the audience who've joined us today to discuss the challenges and opportunities for women entrepreneurs in the healthcare sector. The audience can pose their queries in the Q&A section, and we'll take it up with the panelists. So let me just start off by introducing our panelists who are there on the panel right now. Our international guest is yet to join, but we have with us Padma Pandita Muku, who's director at Jai Sai Ram Hospital. Padma is a chartered accountant by profession, who along with her husband, Dr. Ajay Muku, had a dream of setting up a healthcare facility. She's the driving force of the center and works relentlessly in collaboration with different stakeholders to cater to the multiple medical needs at affordable costs. A warm welcome to you, Padma.
Thank you so much. Thanks, Ruby, and thanks, Shabana.
Thank you. We also have with us internal medicine specialist, social entrepreneur, and a well-known health show host on television, Dr. Swati Maheshwari. Dr. Swati has a rich experience of over 15 years in both directly delivering healthcare in a clinical setting as well as managing healthcare services. Her interest in strategic development of healthcare services and a desire to develop in this direction led to a move from her role as a physician to a transformational role in healthcare. Welcome to the panel, Dr. Swati. We've also got with us today Dr. Priyanka Göyat, who's an orthodontist and dentofacial orthopedic surgeon or a cosmetologist. She's the founder of Rejové Clinique, which is a skin, hair, and dental aesthetic clinic equipped with the latest global technologies. Dr. Priyanka is a firm believer of the fact that dentistry in itself is complete science, According to her, it's a perfect combination of aesthetics and science and can make a huge impact on an individual's look, feel, and function, which ultimately aids in improving their self-confidence. Welcome to the panel, Dr. Priyanka.
Thank you, Ruby. Thank you, BRICS.
Thank you. So, as women and entrepreneurs, most of us have gone through the reality stated by Sheryl Sandberg in a famous quote: "You must be defined not just by what you achieve, but by how you survive." And the pandemic has proven these words true for most of us. So let us start the panel with quick introductory remarks from the panelists on their journey as an entrepreneur in the healthcare space, and especially the challenges that they faced during the pandemic. We'll start with Padma.
Yeah, sure. Thank you so much, Ruby. My childhood dream was to become a doctor, like every other child, which was the dream of my parents. But I believe there were better things planned for me. I took a CA after doing my graduation in zoology honors. And when it was time to get married, I had to make a choice. I wanted to marry a doctor, buy versus make model. So, I got into a doctor's family. Having said that, I am in personal capacity, as you rightly said, working with my husband, Dr. Ajay Muku, as the director for Jai Sai Ram Hospital, which is at an upcoming area where the facility of Medicare is very, very limited. It's at a, and I believe Shoshmita knows about it, upcoming area. Now, the idea was to have best class facility at an affordable cost. The USP, that we have is with care. I mean, a lot of hospitals, we try to juggle between the attention from the healthcare workers to the treatments that is happening there. But at Jai Sai Ram Hospital, care is something we give priority to. It's not, every patient coming as a patient, we treat them. The staff is trained in a way that the patients, along with the medical, they feel at home. Now, pandemic has taught a lot of things, and I believe to everybody, to every sector, and to us, women entrepreneurs as well. But the public relations, the humbleness that we have, I think it has paid a long way. What I have seen, during the treatment, it was not only the medicine or the equipments, the way you talk to, your patients, the motivation, all the other ways that you deal with them were little way, ahead of curing them. As I said, yes, medicines, equipments, they do play a role, but your interpersonal relation with your patients is also something building onto it.
Great. Where exactly is your hospital located in Delhi?
So it's in New Palam Vihar, Dwarka Expressway, which is still coming up.
Yeah.
We started in 2016, and I would say, for a couple of years, we are still, and in fact, even today, we are still investing because, the people have still not come there. The occupancy is just 20-30%. But I think the dream was at least people come and they see some facility there, right? So that was the vision.
And healthcare is the most important infrastructure when you're developing an area like Dwarka Expressway, especially, which is New Gurgaon in a way. So
exactly. And now I can see some of these property dealers, in their ads near Jai Sai Ram Hospital.
Okay.
Yeah. So that's the landmark. It is now, getting noticed of.
Great. Meanwhile, our international guest, Dr. Sunshine Neka-Mbewana, Director and CEO of Dr. Sunshine Medical Aesthetic and Wellness Clinic, has also joined us from South Africa. Welcome, Doctor. Dr. Sunshine is a medical doctor covering all spectrums of health and wellness with individualized treatments based on client needs. She has also served in the Department of Health of South Africa and is also a member of the Association of Aesthetic Medicine in South Africa since 2018. Welcome to the panel, Dr. Sunshine. Right now, we are going through the journey of entrepreneurs like you. And now I'd like to go on to Dr. Priyanka. How have you become an entrepreneur in the healthcare space, and how's your journey been so far?
Sure, Ruby. So I believe I entered in the field of aesthetic with the vision of creating a difference, where I would see that dentistry on a whole never found an equal footing equivalent to medical sciences, dental sciences as a whole, where there was an amalgamation of dental sciences, skin sciences, and hair sciences, amalgamation of one into an aesthetic center. I started this back in 2017, and with providing the best in class state of art infrastructure and best in class technology, and providing optimal the optimal patient results at an affordable pricing. So this was this is how I started. So in COVID, like owing to COVID, since we had a lot of international clientage coming to us, the patient fall dropped, and then we opened our just entering domestic market, and we opened our avenues to our local doorstep services that we started with. We started with aligners in dentistry, and providing skincare services at your doorstep, like laser therapy, which was dermatologically guided.
Oh, great, great. I think aligners are a big upcoming market, and I think one of the questions later will be around that technology. Right now, I'd like to go to Dr. Maheshwari. If you could tell us about your journey, it looks quite inspiring. A lot of stuff that you've done. Dr. Swati Maheshwari.
Yeah, hi. Thank you so much, Ruby, and thank you, Sharmishta. Thank you, Shabana, and I'd like to thank an invisible person right here over here, Atul Bansal. So, and thanks, BRICS, for having me here. And yes, of course, as you rightly said, I'm an internal medicine specialist. I've worked in India, I've worked in Australia, and I was a senior consultant with Fortis Hospital, Gurgaon. And there was a time when I realized, a doctor's life is more or less confined to the four boundaries of a hospital, their OPD, their IPD patients and all. And I somehow wanted to get out of that gear and go to the villages and go to the mass and, make them understand how important is health. And what we as doctors always feel is that, when you're sitting in a hospital or a clinic or wherever, especially in India, you have so many patients that you don't have too much time to devote to each and every patient that is there, at times, and critical information gets missed, their apprehensions and anxieties, are not addressed. So there are a lot of things which get missed out, and and it hampers their quality of care that actually a patient gets. So I wanted to go out and reach to the mass as well, make them understand how little things in your health, your preventive health, your treatment modalities, kind of matter a lot. Just to give you an example, we advise a lot of inhalers to patients, for that matter, who are asthmatic, who are suffering from respiratory problems and all, everything. And a lot of times these patients on inhalers would come back and say that we are not benefiting from it. We don't think we are getting the relief and all. And most of the doctors, for that matter, would just escalate the dose, thinking that, probably the dose is still insufficient and we need to escalate it. Whereas the problem lying was that the patient didn't know how to use the inhalers properly. Yeah. So actually, the problem like there, and they were not using it properly, and unnecessarily the dose was getting escalated at every OPD visit. So a lot of times there are such simple things, and I think Dr. Priyanka would agree with that, that if you don't explain things properly to a patient and all, the whole treatment goes haywire, their health goes haywire. So there are a lot of such things which we need people to understand as well. So that was the thing that actually kind of galvanized me to go back to the masses as well, explain them how you can't make difference into your own life. And then I started working with the villages as well. So I work with a lot of villages across India, Karnataka, Maharashtra, UP. We tell women how maternal health is so important, how important it is to take care of your newborn child, how important it is to address malnutrition, which is in India is such a big problem, for that matter, how to take care of your pregnancy, a lot of other simple things which actually these women are craving to know. Frankly speaking, there's nobody who can go and tell them that these things are as essential and as simple as they could be, because these are simple things which they just miss out because there's nobody to tell them, nobody to address their problems and all. So frankly speaking, it's been a very, very enriching journey for me as well. Where at one end, I'm interacting with this women in the villages, in the tribal areas, at the every nook and corner of the country. And yes, I have a lot of patients as well. So, that area is also looked after because yes, you need to contribute back to the society. You have studied for so many years medicine, and definitely you want to give back to the society as well. And then I have this media vertical where kind of create a lot of awareness about health in people. So that's been the journey so far, and I would say it's been quite an interesting journey.
I would say interesting and inspiring also. So, great. We have with us Dr. Sunshine from South Africa here. Welcome to the panel, Dr. Sunshine. So if you could tell us a bit about your journey in the healthcare space, how you set up your own center, and what are the challenges that you faced over there during the pandemic?
Thank you so much. Thank you for the opportunity, and I apologize for being unable to join you on time. But I'm happy to be on this platform to share my journey, my story, and the beauty of it, and how I've grown during this trying time. The one thing I must appreciate first is that I understood that without this pandemic, there's a point where I know my clinic wouldn't have grown the way it has grown now. The pandemic has been a difficult, it's a difficult disease, the COVID and everything that came with it. The most difficult thing that I personally had to deal with in the space of my healthcare business, being an esthetician and the wellness clinic, I found it's difficult not to be able to interact, to have interpersonal interaction with the clients. So now things had to change. I had to welcome that things are not going to be the same again, and that not when a person has a beauty problem, it is not about the pigmentation that they have, the wrinkles that they have, but their total well-being has to be taken care of. As people are being isolated, there's a lot of mental breakdowns that we all went through. And it was a journey I had to welcome, that a person will just say, like, "Doc, are you open?" I'm afraid to open because I have to strictly be regulated by the protocols that are on the lockdown levels of the country and set up by the World Health Organization. General visits to doctors are not allowed. But doc, are you open? I need you. Then I have no option. I say, okay, let's talk on the phone. What is it that you need from me? And then it started simply as a way of trying to make sure that you're okay mentally, that, okay, you say you need me. When you say you need me, I know you need me as a doctor and you need me in a specific area. Let's talk about it. Send me everything that send me pictures of what you have. I've gained so much weight. They've gained this. Then it started from there. I saw that, look, I can help them from a distance. It was a challenge because you have to tell the person that go and have a scale now. Go and be able to calculate your BMI. Go and do 1, 2, 3 so that your pigmentations, I'm going to send your treatment via postman, or go and deliver it myself, leave it at your door. But you have to do all these things very cautiously because you know what is what. But you want to keep that person's mental well-being alive, and that as you are enclosed, this is not the last. We are not lost. This is not the last. You are still going to be able to live. Your self-care is very important to yourself. But it's difficult because I love to interact, but it has also taught me to learn, look, technology can do this. I can solve things while I'm still at this point. I'm still in my house. I can help you wherever you are. I can reach to wherever they are. It's been a challenging journey, but I've had to appreciate to learn technology. Don't mind that I had to be fiddling around again this morning, but it's a beautiful learning curve where I feel I had grown. And I believe mostly of us had to grow in a way. Thank you so much.
Great, great, great. I understand it's so challenging to provide healthcare services to your patient amidst the pandemic. You cannot say no being a doctor. But as an entrepreneur, today in BRICS, our big focus is women entrepreneurs in the healthcare space. And we all are entrepreneurs in some form and we know our challenges. But as a healthcare entrepreneur, my question to you, Dr. Swati, is what is your perspective on the challenges and opportunities for entrepreneurs in the healthcare sector, especially women? What are the emerging areas for them? What is your viewpoint?
Definitely. See, some of the challenges definitely are there being a woman itself. So, be it gender bias, be it the societal and the cultural barriers that are there, be it your limitation to the finance institutes that are there, your knowledge about them, the kind of environment that you're there with, all those kind of safety and regulatory approvals which you're not aware of, for that matter being. And then again, probably the education system is such, and especially in India, that a lot of females still lag into that. So there are a lot of problems with the women, but when it comes to the healthcare sector, another big problem specifically to the sector is, creating awareness about a condition is itself such a big challenge. Definitely pandemic, has brought in that health awareness, but trust me, health is still a very casual thing for most of the people, until and unless there is a health emergency, until and unless there are alarming signs, most of the people would just, brush away their symptoms, their early symptoms, their problems, their laziness, their fatigue, their headaches. And most of these things, we generally take them very casually for that matter. Just pop in a pill and you're solved for the day, or you're sorted. We generally don't actually go to a doctor and consult and, we can be mindful of what our health needs are, our body needs are for that matter. So we generally, kind of look towards health, these apps, these different kind of services that are there, until and unless we really are sitting at something which is very alarming for that matter. So, most of the people would be busy in their daily course, in their lives, in their profession, maybe in their families, and we kind of brush this away. So the major challenge in healthcare sector, first of all, is to create awareness about the condition. So now if you're launching an app about PCOS, or you're launching an app about migraine, or you're launching an app about diabetes or hypertension for that matter, you won't find too many takers for it as well. People might get hooked onto it for a while, and then they might just, kind of drift away from it because they realize there are 100 other things to tend to than to health. So that is one region. Then second region is, bringing in technology and making people understand that technology can change your outcomes for that matter. Definitely pandemic has helped it in that, because, we have now, I think the digital health section, if you look at it, there's a cusp of a revolution now, because see, we have e-commerce platforms now, we have precision diagnosis, we have effective medications, teleconsultations, we have the drugs being available at just a click away, right? You can get your medicines at home. The biggest thing is that you can monitor the health of your aging parents sitting kilometers away now, and you can see whether they've even taken their medications or not. You can make people available to them, and more or less now, people are kind of moving towards emergency medications and emergency handling as well. So now, when earlier we had our neighbors and the people around us and the near and dear ones running in the times of emergencies, now we have these different kind of apps who help you kind of reach to the right doctor, to reach to the right hospital in right time. And also a lot of things are coming up now. People are taking these things up now as well, because they are more convenient, more easily available. And especially during pandemic, we were restricted because we couldn't move around too much. It was not that easy to reach out and see a doctor. And, people also started having this confidence in teleconsultations. And now, that, even in the night or day or whatever, you have your doctor at a video chat maybe, or at a regular phone call or whatever, you can reach out to them, get your problem solved and all and everything. So things are changing for that matter. But when it comes to women entrepreneurs in the health sector, again, we need a lot of enabling and comprehensive policy frameworks from the government for that matter. How we can arrange these financial, how can we gear our financial institutions to provide the seed funding, to provide more investment to these women entrepreneurs who are there. And then again, a big challenge is creating networks. A lot of female entrepreneurs for that matter find it very difficult to create networks to enhance their business for that matter, or they can't go out in the night, or they can't go out for parties, they can't socialize too much to actually kind of foster your networks. It gets difficult because at one point of time you have your family as well to cater to, and then maybe unsafe conditions or whatever. So there are a lot of kind of problems which we really need to look at. So I feel the government, the NGOs, the private enterprises, the financial institutions, a lot of these people need to come together to help these women entrepreneurs who want to make a difference to the world, who want to, break these glass ceilings and be trailblazers or change makers, and who have fresh ideas, innovative ideas, where they feel that, they can bridge the gap that is there in the community at the present moment, because the services are there, a lot of takers are there, but the right platform is not there, or the right way to go about it is not there. So definitely, a lot of women are wanting to go out and do all this stuff. The only thing I feel is, one, yes, definitely you have to believe in yourself, and you have to believe the fact that a woman has to climb higher mountains than a man for that matter, and you have more challenges to overcome than a man in a society, because we live in a patriarchal society. But still, if and a good part I would say is there's a noticeable change in the political willpower also. So the government is trying to bring in lots of new schemes to actually, kind of help the women entrepreneurs, where they can network better, where they can get more financial help, where they can get mentorship for that matter, so that their ideas, they can hone on to their ideas and make them a bit better. So definitely, I think we are working towards it. We are trying to make the environment more conducive, but yes, it will take a little more while for us to actually make it very convenient for women to step into an entrepreneur shoe and, kind of start their own business and all. You do have a lot of role models right now, but yes, it would take a little while, I think, for each and everyone to think in that direction.
Sure, sure. I think Sharmishta, you were mentioning you have a comment. So what is it on this aspect?
I want to make a comment when Padma was speaking.
Yeah, what is it?
A small anecdote, because her hospital is quite close to my place, and I got my vaccines from her hospital actually. So I entered into her hospital and I was like surprised, because that's not an area someone will invest so much of money and bring that kind of a facility. So I was pretty surprised. And during the pandemic, when I heard the name over and over again. So their ambulances were always available outside our society to ferry people, and they were always available. So that's why I thought that we should invite Padma and ask her to share the journey, because we were all very happy, and it was the most polite. I see, not to comment on general working medical staff, because unko bahut kaam hota hai. They deal with a lot of different kind of people. So sometimes they come across little, get it done, do this. But their staff was so friendly. I did not have a slot booked. I walked in the hospital. So I said, "Nee, मैंने तो नहीं book करा." And then the person on the counter said, "No issues, madam. You sit, and I'll do it for you." And she did. And then I got a vaccine in like 10 minutes and I walked out. So I was like, oh my God, and it was the time when people were struggling for a vaccine. It's not now, up to, you can get it easily. So I was very happy. And what she said, I was just trying to endorse what she's saying, because it's my first-hand experience. Swati, because now you've spoken, I want to add one thing. We are there for you. If you have a great idea, we are here at BRICS V. That's why we are here. That's why we founded this wing specifically under a great organization. So we already had BRICS. We already had a lot of women as our members, but we thought that we need to give a little extra push to the women entrepreneurs, and that's why we created a vertical. So if you have some great ideas, we are listening. If you have a great app in the making, we'll have a event coming to support startups, I think in February. So we're there. We help with the funding. We help with the mentorship. So let's talk more, and we are right there. So that's what I wanted to say. Thank you so much, Ruby. and we can probably.
I mean, it's great to hear.
Ruby, I want to Ruby, sorry, I want to add one point. So thank you, Shamishta, for your endorsement. Yes, we wanted our staff to be more polite, in the not only during pandemic, but overall. I think that's what we teach them. Now, to Dr. Swati's point, I completely agree. It has been proven that women-owned businesses earn revenue, which is like 8 to 10% more than earned by men in same industry, same age group. Okay. But unfortunately, only 5% of women-owned businesses get the funding. 77% of funding is lent to, men-owned businesses. So that is where the gap is, right? So we are there, we have skill set, we believe in ourselves, but then there are social hurdles. Now, how do we overcome those hurdles? I think this is the platform where at least we can brainstorm. I know there are, as she mentioned, government has plans, they are doing their bit, there are policies, but are those policies popularized? Execution level, I mean, it's okay to say that bank will grant you a loan, but when you reach out to a bank, they have no idea of it, right? So at execution level, to get those policies, to make use of those policies, that's still a challenge. So that is where I think we need to get together, use that networking, see where we can, whether it's apps or whether it's, financing, talk to each other, develop those backup and understand from each other how we can help. Yeah,
right. I mean, absolutely. That's a very valid point. Because
I have one small comment to what Padma just said, that, women don't get the funding as much as men. You know why? Because the people who are approving it are also men. So we actually need more women in the policy making.
Yes.
Send 33% of women in the parliament and things will change.
See, you're right, Sharmishta, it's a big boys club also over there, but it's also a fact what Padma said that, very little awareness of the government incentives. I run a portal where I put a lot of information for women entrepreneurs and incentives, but we did a survey and, so few women know what are the incentives available to them. And, here we have somebody with us, Dr. Priyanka, who's recently got a funding. So, this is a question that I would like to ask you. You didn't go for a government funding, but, we read India has been ranked 4th globally for health tech investments by VCs since 2016. Now, Rejové has recently got a USD 1 million funding announcement for your next gen clear aligners. So what has been your experience and how has the role of technology, how has technology helped you in getting funding and becoming a game changer in the technology, in the healthcare sector?
Thank you for the question, Ruby. Technology has completely revolutionized dentistry, where I would say that dentistry is a very under-penetrated market, whereas I would want to talk for there is very less awareness, I think, in dental health. And post-COVID, in COVID, there was a mental shift of the patients, where they started to value dental health also more. And technology has enabled with having teleconsultations. Now we have new tech, when we have new 3D scanners, new 3D printers, where we can have more predictable results by using machine learning, artificial intelligence. And so in COVID, we seen that there was a revolution in dentistry, where the aligner industry emerged as a very reliable industry, where we create the traditional braces industry was replaced with the aligner industry, where we use technology to predict outcomes. And so what happened during COVID, patients who wanted to have their teeth movement treatment done, the treatment was not hampered, because we used the technology to send the trays to the patients, where they would just sit at home and the treatment would still continue. and the treatment outcomes were very predictable. So we actually wanted, we have expanded in this horizon, and we raised our funding on aligners. We have raised it with a venture capitalist from Singapore. This the funding that we've received is now we are using it to expand our patient base, our customer base, and to expand and to create awareness, moreover awareness. Dentistry is a very elective procedure, so it's a very elective procedure, and in during COVID, what we seen is the patients were really scared to step out of their house, also because they feared moving out of the house, they feared any kind of infection. So we came up with our new unique way of going to the patients, where the dentistry as a service was at their convenience and at an affordable price.
Yeah, affordability is very important, as you are mentioning. And here I have two questions for Dr. Sunshine. You are in a country where affordable healthcare and the role of technology are almost synonymous. And you've been talking about how technology is making a huge difference. So what is your view on this? How has it become a game changer for the masses? And the same question I would like to ask Padma, because you run a hospital. So Dr. Sunshine, your viewpoint. You're on mute. You're on mute, Dr. Sunshine. Yeah, I think.
Hello, can you hear me?
We can hear you now. Yeah.
Oh, okay. Thank you so much. In South Africa, in this present moment, affordability and technology are truly walk hand in hand. And in the healthcare sector, I found that, if we want women entrepreneurs and in the healthcare sector to be able to progress, we have had to make changes in looking at your target market. If you like, for you to be able to reach more people, we have had to make use digital platforms, social media, to be able to advertise affordable packages, like regulate your packages so that people can be able to get your services more. That, like, without you having to incur debt, make sure that you are advertising the right prices so that each and everyone will have something to get out of you. And you are not sitting there on the mind that you've got all the treatment, but it's not going anywhere because people cannot afford. Use the simple platforms like your WhatsApp, like use your Facebook, because people during the lockdown, they are more concentrated, they concentrate more because they don't have anything more to do. They are always on their phones, they're always on their PCs and stuff. So use all that is available for you to be able to reach the people that you did not even think would use your services. And with the rand as our currency, like with me, I'm in a small town in East London, but people would go to Johannesburg for the services that I offer because they did not know. But now, with COVID, I was able to use the technology, digital marketing, the screens that are shown at restaurants, but even though the restaurants are not open, they are there for just taking. People can see as they are queuing there that there's this doctor, she's around here. They use that, okay, what does she have? And then they will call. So it's simple things that we did not know how to use on our hands, and that, okay, people can get to know about you in this way. We think we need to get someone that will cost you 50,000 rands to market you. But it showed us something that the pandemic showed us something that learn to use something that you have, learn to use the little that you know to the maximum, to reach as many people as you can, and make sure that what you do when you do it to the best of your ability, so that people can they start talking. It's okay. People talk over the phone. It's okay. No, I went to this doctor. There is this doctor. So it's still working. The person to person works. The technology works. Everything that we are able to use, let's use it. Let's not find reasons around okay, we can't.
You're
We
right.
can, and let's maximize on what we have. We are women, truly. We are being tramped on. I have no funding. I've never had any funding. I want funding because I want to grow my clinic. I want to reach out more. But now,
I think you and Dr. Priyanka should connect on the side. She's already got her funding. She can drive you to some VCs. You're great.
Yes.
And you're so Padma, here a question for you, because affordable healthcare is a key focus for you. And how does technology help you provide this? A quick,
Sure. See, there are two aspects to technology. One is definitely the improved and more powerful high, end equipments, which takes a bit of a time and definitely the rises the cost of the treatment. But in addition to that, there are, as Dr. Sunshine said, whatever possible technology, like the infrastructure piece of it, whether it's telehealth, telemedicine, or embracing artificial intelligence. I think telehealth has definitely played a big role during pandemic. I remember, when there were no beds or no oxygen available, we had time slots, wherein we were providing teleconsultation to all the patients. I mean, who were doing sort of an home treatment, quarantined at home, but we had a couple of doctors, who were, taking calls and, sort of guiding them, prescribing medicine. So the available, technology that we have to put to use. As Dr. Priyanka said, now there are technologies on the fingertips, right? The siblings or the parents, the kids, they can monitor the health of their aged parents. In fact, during pandemic, we were getting calls from Germany, Singapore, from the kids of senior citizens who were looking near the area, because they were just Googling and find local hospital. They used to get the details of our hospital. So calling, talking about phones, giving them queries. So I think the possible technologies also helped us, and people are making more and more use of it.
Great. So, before I move to the next question on tourism, one quick response from Dr. Swati in this, because you are a social entrepreneur also. How important do you feel is it to make healthcare affordable for the masses? And that's where, especially entrepreneurs will have a big role to play.
Definitely. Sorry, that was for Priyanka.
Go ahead.
Okay,
yeah, Dr. Swati.
So definitely, see what Padma is saying here is very right. During pandemics, we were treating patients at home with IV fluids and oxygen and everything, sitting back at our homes and they sitting in their homes, and we were managing all this. And the mindset is broken now. Earlier people thought that it's only mild disease where you call a doctor or you take video consults and all. But now people do realize that even in serious conditions, you can take video consults and it could be meaningful, it could be beneficial to their outcomes and all. So the mindset is also changing, because if you remember a few years back, we were trying to bring in telemedicine and it nosedived completely because people were not comfortable, the doctors were not comfortable, but the scenario has changed completely now. It's really turntables. What I feel is that we need to kind of foster this more into people, kind of build onto this, so that the whole momentum that we have right now is not broken. Because what happens is, as soon as the pandemic goes over, as soon as it kind of tails off, the attitude towards health, trust me, would go back to what it was earlier. It is very easy for people to have a short memory, for that matter, and we have a lot of other things in our life which we give importance than our health. Some people would still feel that health is important and they would cling on to it, but most of the people, for that matter, would go back to the attitude that they had towards health, which was pre-pandemic. So, we need to keep on building on that momentum so that we don't lose on it. And when I talk, I just don't talk about the urban setup. There is there's lots going on the rural side as well, because I work there and I see the sentiments over there. A lot of women entrepreneurs, for that matter, want to kind of do a lot of work, but they don't have the right options. They don't have the right opportunities. They don't know whom to go to. Though the self-help groups, I would say, are doing great work, fantastic work at the rural level, because they are trying to bring that information to this women. They are trying to connect them forward. They're trying to get them financial aids and everything. But still, if you look at the rural setup, and if you look at these 3-tier cities and 2-tier cities, and the women still are grappling over there, trying to find their feet, trying to find the right ways to go about any kind of business, especially in the healthcare sector, if they're looking at it. Urban definitely is a little different picture altogether, because you have more networks, you have more opportunities, you're exposed to platforms, so it becomes a little more easy. But yes, we need to work on both the fronts, I surely feel, because the needs are very different in both the fields. When it comes to urban, the needs are very different. When it comes to rural, the needs are very different. And I think we need a lot of people to, a lot of stakeholders to kind of integrate at certain platform to, help these women entrepreneurs to actually realize their dreams, for that matter. And now I feel women are, dabbling into fields which were traditionally, I think, areas or bastions of male dominance. So now the women are kind of moving into those fields as well, and kind of creating waves as well.
Yeah, thanks, Dr. Swati. I think we have what you raised is an important point, and one aspect, since we are a BRICS chamber, is medical tourism, and that's we just have 10 minutes left, so I would like to quickly have the viewpoints of the panelists on this, because tourism is an important area of cooperation amongst BRICS countries, and medical tourism is something that has emerged in a big way. So so how has healthcare tourism being impacted, and what has been the impact on medical tourism? And there are two people here, I think, for whom medical tourism was big, and is something that we're targeting in a big way. So Dr. Priyanka and Dr. Sanchin, I'll request your quick viewpoints on this. Dr. Priyanka.
Thank you, Ruby. So quickly, when I started with Rejové Clinic, my entire patient base was international, where we were equipped to cater to any kind of complicated and difficult dental cases, where we would do full mouth rehabilitation, and our patient base was usually the Middle East, the UK, US, Australia, where the healthcare, where the dental services, the dental sciences are very expensive, and we being in par with the international standard of dental sciences, with our state-of-the-art technology and our fully equipped and advanced equipped infrastructure. So I would do various exciting cases, and so when the pandemic started, a lot of my patients who we were catering to were somehow stuck in the country also. And yes, so they were stuck in the country. And when we started post the COVID, when the lockdown was raised, I could do the part 2 rehabilitation for them. But yes, since India is a huge hub, it's one of it's ranked 10th out of the 46 countries where medical tourisms are predominantly seen. So I think a lot of patients did suffer because of restrictions to travel. And a lot of my patients did bear a brunt of the lockdown. And also because India, dentistry, we offer it in par with the international standards. And I think we took a lot of hit, and yeah. So
I think we'll have to extend this panel a bit, but a quick viewpoint from you, Dr. Sanchin, because you're in South Africa. Is medical tourism big for you also? We can't hear you. You're on mute again.
Okay. Thank you so much, Ruby. Thank you for this platform, because now, like you said, that I must connect with Dr. Priyanka after this. I see, because in South Africa we are below par on what healthcare tourism should be like. Because like how I started my clinic, I went to do aesthetic medicine, And it is a field that I felt its way. I would get more tourism. I would get the certain target markets that I know that it would be easy for me to get. But as time went on, I realized that with the marketing and the small town mind, that is where I'm at, where people look at you as a person and feel like, no man, oh, it's Sunshine. She's gonna be driving a Mac because of us. That's the mindset of the people. And that is the mindset that I know personally needs to be changed. And I know that South Africans, our healthcare sector provide best plastic surgeons, blessed of everything, but we are not leveraging on it. It's time that we divert the cosmetic surgery people from going to Turkey when we have the services here. But it's only because of the mindset. If we can be able to just change the mindset of the people and advertise, use the technology that we have, that look what you think you can get outside, we have here. But it's a difficult one. I won't lie, because people start looking at you as an individual than as a healthcare professional that you are. But you know that you can, and you get people from outside, few people from outside that can endorse you. But you want to be endorsed by, I want that each and every tourist, they must know that when they get to East London, there's Dr. Sunshine who provides IV vitamin drips, who provides this and this. If I happen to stay for more than 2 weeks and I need this treatment, I'm going to get it from her without any hassle. I mustn't have to be going around. It must be straight up. But our tourism sector is very reluctant in a way to step into the healthcare, to assist the healthcare, because it's usually because you're general practitioner. Now I am a esthetician as much as a medical practitioner. Help me to help our people. That's all I want. But it's not easy.
I would like to add, Dr. Sunshine here, sorry to interrupt, that a lot of people from India will visit South Africa for 2 weeks after this. I think Sharmishta and Shabana ji will be the first people to go. So,
please come.
So we'll get a package discount from you.
Absolutely.
Absolutely.
Yes, please.
Yeah. So, one thing, since we are nearing the end of our discussion, but I think we'll stretch it a bit because there are a lot of interesting questions that are coming. But, people say often brilliant ideas are undone by patchy execution, sloppy planning. And there are a lot of people who are listening to this in the audience and they would like to be entrepreneurs in the healthcare space. So, each of you, a quick tip from you, a success mantra from you for women who look up to you as role models in the healthcare space. I would start with Padma.
Sure. See, first and foremost, don't be afraid to have big plans. Not sometimes, I would say usually women do underestimate themselves and the potential of their ideas. I would really request them to believe in themselves, have confidence in yourself and your idea, leverage your network and grow, and keep yourself distant from negativity, right? There are a lot of people who would tell you, oh, no, this idea doesn't, you will need a lot of investment. See, for medical practitioners, it's an investment. It's not a product that you go in the market and sell it out. It definitely needs a lot of patience, and we are experiencing that. We have set up this hospital in 2017 and we are still infusing funds, right? So it definitely has a gestation period. Every business has a gestation period. Don't be afraid of that. Have faith in your plan.
Yeah.
Don't look back.
Sure.
That's my mantra.
Great. I think it's a mantra for all and entrepreneurs, irrespective of the healthcare space. Dr. Swati, a quick one-liner, two-liner from you on your success mantra.
Add on to what Padma said right now. You really need, in these times, you need to leverage technology, I would say. Be very innovative in what you're thinking, because that could be a path breaker and that could lead you to great success for that matter. And definitely, like Padma said, believe in yourself, believe in the fact and, that we can do it and we will do it. And if you look at it now, I think one should really look at role model stories as well, because, they are very inspirational, they are very motivational. They kind of guide you as to how, people have overcome their failures, because failure is paramount for success. So don't feel let down if you fail, if you face failures, because that is what is your stepping stone towards success, I would say.
Great. And Dr. Priyanka?
So I would agree with Dr. Padma and Dr. Swati, where I would want to say that we should believe women, we should believe in ourselves, and and we should know who we are, rather than, of course, we are what we are, but we should know who we are and never give up. So even for me, like downsizing from 5 clinics to 3 clinics, to a point where I thought, maybe I don't know how I'll take it ahead, to a point bouncing back, and now looking forward to the new journey that I've undertaken. So I think believing in oneself is very, very important.
What you said, I feel it's resilience, in challenging times. That's what keeps entrepreneurs going, entrepreneurs like you and the others. So great. And Dr. Sunshine, what is your mantra?
I'm saying, don't be afraid to dream big. Don't be afraid to dream like you are a man.
More than a man.
Yes, more than, thank you. Dream big and let your vision manifest it within you, and make sure that in each and everything that you do, you don't forget that vision. You want to push it forward by all possible means. You can, you will, you shall, in all possible ways. And associate yourself with people that will grow you, that will help you to culminate your vision. People that are positive about everything, because that vision of yours might change the world, that might touch so many people. Do not be afraid.
Yeah.
Keep on keeping on, keep on keeping on. Make noise. If it has to be that you're on Facebook 10 times about your vision, put it out there. Don't be afraid to be loud about it.
And what
Nobody will take
for the
it from
future,
you.
Dr. Sunshine? What is your vision for the future?
My vision for the future is this clinic. It's a wellness clinic. I do people come for an hour for a facial rejuvenation. That is a healing therapy. And when they leave, it's sad because they feel like they should sleep. So my vision is to have a center, a health wellness center, where a person can come to rejuvenate for 2 days, 3 days if they want to. Detox, not to be in a hospital where there's a stigma that, oh, there's St. Mark's Hospital. That means you have a mental problem. That means you're going crazy. Be at a center where you are going to be taken care of. And it's because you are fatigued, you just need a break. You need that away moment.
So
Let that away place be this.
So Shabana ji, please plan that break for the BRICS CCI team. Rejuvenation. We need rejuvenation post the pandemic.
Yes,
absolutely. And we have this forum.
She has to.
Yes, and we have this forum today with us. We already are feeling rejuvenated. Let me tell you, I've been going through very tough times recently, and I'm feeling so much more happier interacting with all of you. It's like, it's an environment that we can build together. We women can build together with so much positive, full of good energy. And, that just as COVID has taught us to work from home, to study from home, treatment at home also is a way to go. And as Dr. Swati,
closer to the home, because Dr. Priyanka is right here in Delhi with a wellness clinic. So, Sharmishta and me can start off by going there. Yeah, Dr. Priyanka, what's your vision for the future?
So I think convenience and service, medical service at doorsteps is what I think is the future, at your convenience, where convenience is a product. And obviously, for Rejové, I see Rejové as a domestic and then as a global brand, where we are very true to our morals and philosophy, and delivering the best possible treatment to the patients.
Great. Dr. Swati, what's your vision? You're a multifaceted personality. So
see, what I would feel is, the ability to instill proactive attitude towards health is something that, I'm really looking at right now, be it whichever domain it might be, for people to cling on to that. And then, that is what would actually bring in equitable and accessible healthcare each and everywhere, to each and every nook and corner of the country for that matter, because we have people who want to access these services. We have people who want to leverage the technology, who want to actually have health, right there where they want it and when they want it. So I think it's time that we all should actually contribute towards it, be it attitudes, be it the kind of services that we pick, or be it creating those services so that, people can leverage them. I think that should be the key.
there's a question for you, a quick response if possible. It's there that how can tribal women entrepreneurs, use marketing tools to start to, promote the business of traditional medicines? I think you are Dr. Padma, but I feel it's more of your line if you could just answer.
See, definitely, I think what you need to leverage again is technology for that matter, and the social media platforms that are there, and various other platforms like BRICS, for that matter, could come to your aid and help you get those platforms even further, and help you market your stuff better. But then, yes, you have to look at both the ways. It has to be the local market that you're looking at, plus the market which is beyond your boundaries, which you would definitely want to reach out and kind of capture. So I think definitely, you need to leverage technology there, because just simple marketing without technology would not get you the results and that you're looking at. So you have to kind of use all those different platforms that are there, be innovative in trying with the marketing activities that you're doing as well. That could help you break the ice. And secondly, yes, I would say that, go and get it. That is what the attitude that is required. So be it, traveling places, be it fostering more networks for yourself, be it kind of, reaching out to more and more people through social media platforms. That's the way to go about it. And then, yes, remember one thing, that whatever you're selling should have scientific background.
Exactly. The government has a big role to play also in bringing tribal entrepreneurs to the forefront, all the government incentives that we've been talking about. Padma-ji, what's your vision for the future?
So definitely, I mean, the vision is to have affordable, and best care healthcare facility to neighborhood, and which we want to expand to other areas of India. And I think now I'm seeing that somewhere near Sunshine's recreational, healthcare facility, we want to have a setup of Jai Sai Ram. Sunshine, we are coming there.
Yes, yes, yes.
And that's what we are here for, to help you.
Oh,
Yeah,
great.
definitely.
Great. See, Dr.
Yeah,
Sanjay, we already have a branch coming up in India and Delhi.
Yes.
Yeah. Great. So, we are a lot of women in the audience, and BRICS we is for women, and we are getting questions in the panel also, because we have skin and healthcare specialists here on, what are some of the tips that you would recommend as healthcare professionals and skin and healthcare experts for working women and for stressed entrepreneurs like me, Shabana ji, we're always running around. A quick beauty tip from all of you for how to beat the stress and maintain a glow like you all have. So I think we should start off with whoever goes first. Dr. Priyanka, any tip?
Obviously, Priyanka, look at your face, man. I've been looking.
Yeah, I was thinking the glow coming from so.
The glow is amazing. Our panelists are all glowing, and Sunshine is topping it all.
Dr. Priyanka.
So I would, in my opinion, say that mindful eating, mindful thinking, being in a positive frame of mind, and taking care of yourself in small little ways that you can, and obviously on and off. Also, because I want to create awareness around dentistry, because I think it's a very underpenetrated market, and we take dentistry. I think it's of course it's an elective procedure, but we kind of undermine it, and we kind of, I have seen the Indian and international population taking oral health not so seriously. So I would say, please visit your dentist in every 6 months, and drink a lot of water, and mindful eating and thinking. Yes.
You also have a lot of specialized facials in your
Yes.
training in Delhi. So you should give us package discounts for all of that.
Of course, of course.
Ruby, you are the best panelist ever.
No, she's got those facials. It was there in Delhi Times the other days. You didn't mention those. So what are these, some of these special facials?
So we have personalized facials and treatment plans according to your skin type, what all we can improve in your skin, specific to every patient's need actually, and it's specially curated. So I have, we are a panel of dermatologists, plastic surgeons, cosmetologists working and curating these treatments.
Great, great. Dr. Sunshine, from you. What is
wow. Oh my gosh, you know, this today is the 16th of December in South Africa. It's the end of the 16 days of activism against gender-based violence. So it's one of those things that are close to your heart, to my heart as a woman. One thing I want to say to each and every woman: love yourself. Self-care, take care of that body. You only have one body, and when that body,
so true,
it's gone. So you take care of that body from head to toe, inside and outside. If you can come to me every 3 months, I will do that. But do regular checkups. Do make sure that you are taking care, you are physically fit, because one thing I know, whatever we can hate exercise to whatever, but one thing I know, it's got a therapy in it. It just, even if you have a skipping rope at home, ride that bike for 30 minutes, it makes a difference than you sitting on a couch and watching a TV. It has an effect on your health, and even on your mental health and on your body. So we need to just have that thing that we start loving you and love the body, nourish the body, give it what you know will make it live longer with, quantity and quality, longevity with quality.
Great.
So we want that.
Longevity with quality. That's very important. That's a great tip. That's a great tip. Dr. Swati, you're glowing, so you have to give us some.
Well, I would say there are three mantras that I believe in. First of all is act now. So, a lot of times we park away our problems. We park away the fact that, okay, our skin is having problem. We look at it another week down, or we'll do this. And then, we'll kind of tend to our problems and all. So first of all is act now. Second is consistency. You start off with a lot of things. You start going to the gym, you start going with a new fresh diet or whatever, but then you tend to leave it midway. And, so that I feel is a big problem. And then you tend to lose confidence in those therapies, and you start to lose confidence in those techniques as well. And third, I would say, is gratitude. So at the end of the day, you feel the gratitude, you feel that, you are blessed, and you have been, given a lot of, for that matter, I think, talent and a lot of things surrounding you, your family, your workplace, your everything. If you feel the gratitude for that at the end of the day, then a lot of negativity, kind of just goes away for that matter, and your stress goes away, and you kind of get the energy for the next day as well, and for your dreams to materialize. So I think that is something very, very essential, because that helps all the negativity just, kind of vanish for that matter, and especially not just your own negativity, the negativity which is around you in your environment and everything, because then you start seeing the goodness of it actually, and not the bad part to it. So I think these are the three mantras that I would say, just hold on to them and give it glow.
Yeah, great. Padma,
surely. I think most of the panelists have definitely, covered most of it, but I would want to reiterate self-care, and self-care requires us to act. Like, Swati said, our health takes a backseat. So we just need to act. In addition to that, I would also want to, for females, be assertive, learn to relax, have that me time. And it goes for any professional, right? So have that me time. Know when to say no. learn when to say no. I mean, in case you're not wanting to do anything, just say no. One important thing in which I used to struggle is delegate and outsource. A lot of times,
Yeah, that's true for
yes,
women
we
especially.
always, wanted it, whether it's, kids' uniform or teaching them or cooking food, we want to do it ourselves. No matter if, there is a 10-15% dip down here, there, don't be perfectionist, right? Delegate and outsource. And leverage your support network the way we are doing it now, the BRICS, thanks to the BRICS platform. I think definitely that's something we should do. Last but not the least, go on vacation, take that break,
Go
enjoy.
to South Africa.
Yes, yes.
Exactly.
Last
Exactly.
question is for you. Take us on a vacation. We all need it.
Yeah. What you said was right. We women, we behave like Ma Durga. I think Shabana ji will also agree. We believe we have 10 arms and we can do everything. That's one thing, delegation, and that brings a lot of stress to your lives also.
Exactly. Yeah.
So that's true. Shabana ji, you wanted to add something? I saw a raised hand.
So I just wanted to say that we have four little angels. I wouldn't say little grown-up angels who are like doctors in this COVID world are like messiahs.
Yeah, true.
Angels or messiahs. So suddenly, and you find them that they're talking about welders, they're talking about healthcare, and you're actually showing us the torch. We have forgotten in the process, we've forgotten ourselves in our day-to-day lives. We just keep parking, as you rightly said, as what Dr. Swati said. We keep procrastinating our own needs and our own requirement. So this is basically an alarm for all of us. Thank you, all of us. I mean, thanks to all of you, and thanks to Ruby ji for being an excellent moderator and bringing out the best from all of them.
Thanks a lot to all of you for coming over for this panel, joining. I thanks to you, Dr. Sunshine, for joining from South Africa. It's been a wonderful discussion. We all have a smile on our faces. So thanks to our audience for being patient listeners. Some of the questions you've asked, we couldn't take it due to lack of time, but we'll definitely take them on the side. We look forward to another such session soon again. Now I request Sharmishta to give the closing remarks.
Thanks, Ruby. I don't think I've attended such a fun webinar a long time. And I think it's the lipsticks. I think it's the lipsticks. A lipstick make the world look better and feel better. I'm sure everybody agrees to it. What a joy and fun having a all women's panel. I have been to so many webinars, I sleep. People are the statistics and numbers, and they're telling and they're going on. And this was so fun. And it was not only fun, we had taken back so much. I am seriously suggesting Dr. Sunshine, you should take up, TED Talks, being a public speaker as a secondary profession. You will kill it. I'm sure everybody agrees to that. She was a great speaker. Swati is already doing such great work. We are here to support you in every which way we can. We have to reach out to the last person. Empowerment is not about the first 2%. The fortune is at the bottom of the pyramid. When you reach there, and one thing I have, because I am a developmental economist, so that the section that Swati is working with is also the section that I work with. So I know that they're very, very intelligent women. Never think that only because a woman is a tribal, she's living in a village, she's less than you. No, she's not. She's sharp, she's intelligent, she's ready. You tell them one new thing, you tell a new thing to a kid who's going to a college, driving a fancy car, they'll not listen to you. You give one piece of great advice to a person they will not only listen to you, they'll act on it. They'll be grateful. They'll put in the hard work. I'm so sorry. I don't want to generalize. The kid might also do it. I'm not saying that they won't. Because so there is a lot of great potential. A little help can go a really long way. It's like, it's the excesses and the not haves, a very unfair world we live in, so that we all know. So how we can, health is something that God has given us, right? It's a great equalizer. Then there can be people who are like, we don't have money, but we have health. And you don't realize what they have. There are people who are like super rich, but they're not healthy. So I think health is a great equalizer. We have a lot to learn and to give. Traditional practices, traditional medicine, Swati said, rightly pointed out, it has to be proven by some scientific backing. It should not be harmful, should not be mumbo jumbo, so to say. But yes, it can be inculcated. Why not? Everything is welcome. We need to have many more such interactions. And what is very amazing to me about this panel, now that it's coming to an end, is it never seemed like we're talking on a subject. It seemed like we're talking about everyday lives, with what we are seeing, how. And I think that's health, because health is holistic. We have to consider the environment, we have to consider the mind space, and we have to consider the physical space. There's no single definition of being healthy or health. Everything together encompasses our health and happiness. So this has been a great experience. It could have gone on for a couple of more hours. I think it's high time that we meet. Sunshine, Dr. Sunshine, why don't you, try and plan and pay a visit to us sometimes? That will be wonderful. BRICS can help.
I'm coming.
Savannah will help in whichever way. We can have a great delegate with us. And thank you so much for being such wonderful panelists and seeing the comments that our viewers are making. That's another new. I hardly see the panelists being the audience being so active and sending us so many questions that we're not able to finish all of them. So that actually is a great homage, or a great this thing to how great the panelists have been and how much they have struck a chord with the audience. So thank you so much for being a great panel. Thank you so much, Ruby. Itna she has spoken such relevant things. Ye batao discount package milega. Take us to us, take us to a spa holiday.
All the offers are on record, Sharmishta. We've recorded this discussion.
Yeah, and we have recorded this
Nobody can go
also.
back on the
We have
promises.
recorded this also. So I think this has been great. Padma, Swati, and Priyanka, because we can meet anytime, because we are all available in the same city. And Shabana, I think we should do that.
I think we should plan.
Sunshine must come.
We should do that as soon as we can. And thank you very much. Can I see my other colleagues here? Is Ankita there? Ankita is there, and I think
Suzanne also,
she's there. And thank you so much. Ankita has been the driving force for getting all of this organized. We are just coming here and speaking, but she organizes everything. Thank you so much, Ankita, for all the hard work that you do. And
Thank you all. Thanks to our team. Thanks to Suzanne. Thanks to Richard. Thanks to the
Suzanne, I
backend.
was looking for, but I think she has left.
Yes, she has left. She has exam at 3.
Suzanne has an examination today, but still she was sporting enough to help us with all of this. So this is the first meeting, but by no means the last. Until we meet again, thank you so much. And Shabana, do you want to say something? You have a hand.
Thanks to everybody, all, and thanks to the entire BRICS team, with the back end working. As Sharmishta has also already pointed out, that Ankita was the one who's actually doing all the hard work while we just here and presented ourselves. And Suzanne, Ankita, Richa, Kripa, all of them were there. But to top it all, our panelists have been brilliant. It'll be great to meet all of you. We're planning to have a get-together where we can meet all of you, interact with you. We'll be missing Dr. Sunshine.
Ooh, I can't.
Yeah. So we'll have to make that special effort to go to South Africa to meet you, ma'am, or to have you across here in India.
Please.
Yes, indeed, we will do that very soon.
Thank you.
Thanks to all of you.
Thank you.
Thanks,
Thank
Rupi.
you.
Thanks, Sharmishta.
Thanks,
So
everyone.
much. Thank you.
Thanks a lot.
Bye.
Wrap it on.
Thank you.